those reports on. How much do you feel, as Surgeon General, you should be making the connection between climate and health so that that becomes more of the discussion we're having in America today?
So that's a great question. I think climate change is incredibly important. I think it's important not just for me to talk about, but for all leaders in the community to talk about, because this is going to impact all of us. It already is impacting all of us. And it's one of the great threats that we face as a society. I've actually, early on in my term, I actually began talking about the connection between climate change and health, because many people didn't realize that there's actually a health factor here. We know that, for example, as temperatures rise and as the quality of our air declines, that has an impact on kids with asthma, on adults with asthma, on everyone who lives with respiratory diseases like emphysema or chronic bronchitis. We also know that as temperatures rise, that has an impact on our water as well. And as we've seen for example, on the quantity of Vibrio, which is a bacteria in our water. We've also recently we released actually a report on climate change and health, which it was probably about a couple of months ago that we released this at the White House. And one of the things that we profiled in that report is growing understanding that we now have about the impact of climate change on the nutritional content of grains. And this is not something that people thought of before. So we have to be, the more that we understand climate change, the more we understand that it has manifold impacts. And many of these actually impact health. And so that is actually one of the reasons that we've been talking about climate change in my office. I'll be honest with you, sometimes climate change is an issue, sometimes it can get politicized, and sometimes people worry about, ask me, do you really think you should be talking about issues that might be a little controversial? And I think this is actually exactly why we should be talking about these issues, because what we need to do is ensure that facts are guiding us in our discussions, that science is driving our policy, and not opinion, not rumor. Unfortunately, we've seen that has been a challenge when it comes to climate change. We've seen it a challenge actually in many other areas of health as well. But it's one of the reasons that I'll be continuing to talk about the impact of climate change on health.